My name's Emily. I'm going to be doing a physical exam on you today. Can you tell me your full name and date of birth?
Bajan Anthony Duran, 3/22/91.
Thank you. Can you read the release statement?
I, Bajan Duran, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any other devices as soon as it has been reviewed and graded by the instructor.
Thank you. Okay, you can do a room scan, please. Okay, I'm going to approach the patient, make sure my hands are good and warm and clean. I'm going to start with inspection, noting the normal rise and fall of the chest. There is symmetry, noting the lateral diameter is greater than the AP diameter, which is a normal finding. On inspection, I don't see any heaves or lifts. I don't see any cyanosis, so everything is normal there. I'm going to palpate and noting that there's no crepitus. Okay, and I'm going to move you and do the same thing to the backside, feeling crepitus, noting that there's no abnormalities or crepitus. Okay, I'm going to have you say 99.
99, 99, 99, 99.
And I'm going to do the same to the front, noting that there's no abnormal vibrations when he does this.
99,
No friction rubs.
99, 99, 99.
Perfect. Okay, I'm going to have you take a big deep breath for me, noting that the rise and the fall of my thumbs that are at midline near his spine is symmetrical. Again. And the same here. Okay, perfect. I'm going to have you lean forward just a bit. I'm going to do the diaphragmatic excursion. So I'm going to have you take a big deep breath and hold it. I'm going to percuss areas of resonance until I meet dullness, which is about right here. You can let it out. And now I'm going to have you take a big deep breath, blow all your air out, and then hold it. Okay, and I'm going to note areas of resonance or dullness until I meet resonance, which will mark that spot, which is right here. And there are, you can breathe it up, you can breathe normal. There are 3 to 5 centimeters in between this diaphragmatic location, so that is a normal finding. And I would do the same thing on this side and expect to find the same thing. So all of that is normal. I'm going to move on to auscultation. I'm going to listen to the lungs, starting with the bronchial sounds up here near the trachea. Okay, big deep breath. Okay, and I'm going to go back through and do all of this with the bell of my stethoscope. Okay, and I'm going to have you say 99.
99, 99.
And now E-E.
E-E, E-E.
Okay, and I'm going to go to the posterior and do everything the same. All of the long sounds were clear to the anterior side. The bronchophony was normal and the egophony was normal. It was muffled sounds, which I would expect to find. We're going to do the same thing on the posterior. Big deep breath. I'm going to go back through with the bell of my stethoscope and do the same thing. Okay, how do you say 99?
99, 99, 99, 99, 99, 99.
And I'll have you say EE.
EE, 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 EE.
Okay, and I'll have you whisper Scooby-Doo. Okay, all three of those tests were normal. The bronchophony, the egophony, and the whisper test. All of the lung sounds were clear. Respirations are normal, no adventitious breath sounds. So we are going to move on to the cardiac system. So I'll have you lay over here for me. First thing I'll do is just start with inspection, noting any cyanosis, any masses, any abnormalities, any tenderness.
Nope.
Okay. I'm going to palpate the abdominal aorta. No abnormal big pulsations. I'm going to check the carotid arteries on both sides at different times. Noting any jugular vein distension. There's no pulsations or thrills that are very obvious or abnormal. Next, what I'm going to do is note the point of maximal impulse for the apical impulse, which is going to be at the 5th intercostal space, midclavicular line on the left side, which it is there. It's about 1 centimeter. And then I'll compare it to the carotid pulse, and the S1s should be synchronous, which they are. Okay, perfect. So I'm not going to percuss the heart border. If I have a chest radiograph available, that's what I will use. So I'm going to move into auscultating the heart, starting with the atrium on the right side, 2nd intercostal space. Okay. With the bell. Moving over to the pulmonic, which is the left side, 2nd intercostal space. With the bell. Down to the Erbs point, which is the 3rd intercostal space. And with the bell. Down to the 4th intercostal space, which is the tricuspid valve. Over to the mitral valve, which is the 5th intercostal space, midclavicular line on the left side. And with the bell. The heart rhythm, intensity, the rate, everything is normal. I didn't hear any extra sounds, any extra beats, any murmurs. So I'm going to have you roll over to this side, face the left, face the window. And here I'm going to listen for mitral valve stenosis over here at the apex. Noting S1 and S2 for systole and diastole. Okay, great. I'll have you sit up for me. Come to the edge here. And I'm going to listen for aortic regurgitation by having him sit down, lean forward, take a deep breath, and hold it. Okay, great. Everything's normal. All right, I'm going to have you lay back down and I'm going to assess the peripheral vascular system and the lymphatic system. So I'm going to start with the axillary nodes. I'm going to feel around, no abnormal lymph nodes there. Going to go to the brachial pulse. Both are equal and present. Moving on to the radial pulse. Both are equal and present. I'm going to perform the Allen's test while I'm here. So this is going to test the ulnar nerve patency. So I'm going to have you pump your fist 5 times for me, noting that the blood is leaving the hand. And then I'm going to let it go immediately and watch the blood refill so the ulnar nerve is patent. So at this point, I would assess the inguinal nodes in the femoral artery, but for the purpose of this exam, I'll have him leave his pants on, but I would do that in his groins. So moving down, I'm going to feel for the epitrochleal nodes. So I'm going to feel in between the bicep and the tricep, not noting any abnormal lymph nodes there. Okay, so I'm going to move down to his lower extremities. First, I'm going to inspect, see that the hair growth is normal, the color is normal, There's no swelling or edema. Is there any tenderness here?
No.
Okay, perfect. So I'm gonna do the popliteal nodes first, the back of the legs. Okay, those are present. Moving down to the posterior tibial pulses, which are both normal. Moving on to the distal pedal pulses, which are both normal. Okay, that concludes the exam.